Hello, good evening, everybody. I gather that some people are complaining the network is so bad this evening. I pray we are able to manage it. Hope you are all doing fine. Okay.
Yes.
All right. Thank you. So you're going to continue from where you left off yesterday, and that is with the sample transportation. So we've been able to take ourselves through patient preparation, how to prepare our patients, and how to also make sure that we provide them with the right container and to advise them on the correct approaches of collecting the sample. And like you said, if you had our own way, ideally, the sample should be collected in the lab if there is a convenient and a private space within a lab, because in that case, a sample will be submitted to you in the next 5 minutes. Since in most cases that is virtually impossible, patients have no option than to collect the samples either from their homes if they stay close by, or find a suitable place outside the lab, and of course at an extra cost to the patient. All right. And in that case, it means that the sample must be transported to the lab. And all of us know that transporting samples has also its own criteria. So we must be able to take ourselves through the requirements for the transportation. All right. Now, so it is best to collect a sample in a place at or very near the lab to avoid any form of mishandling and temperature changes during the transport. However, like you said, it is sometimes not possible. So when the sample has to be produced from home or from outside fireplace, then the following must happen. One, the patient should, as much as possible, clearly label the sample. You see, sometimes we pre-label the tubes, even in our routine labs. Sometimes we pre-label. That is a very bad practice, because if you pre-label the tube, all right, do you label tubes or we label samples? Somebody should. Do we label tubes or we label samples?
We label samples.
So why do you sometimes label the tubes and give it to the patient?
We label samples.
So you label samples. So the raw tube, which doesn't contain anything, is not a sample. So why do you have to label the tube? And that's what most people do. If you label a tube and then inadvertently somebody picks that tube, okay, and then also goes to use it, and forgetting that the sample has already been labeled, they send to you a sample with a wrong information. So our advice is that just note that we label samples, we don't label tubes. So if you have any container you give to a patient, you label it. That is, to me, as much as possible, it is wrong. All right. So once the sample has now been produced into the tube, then you have a sample. That sample have to be labeled. But you see, in most cases, like I've said, the sample may be produced from the home. And we don't want a sample to be transported without a label. So in that case, as part of your counseling or preparation of the patient, you may have to, if it's an illiterate, then you may have a better way of how to handle that one. But if you can write, you will advise that immediately after you have produced a sample, write your name on it and you write your age. You see, for proper patient identification, we need two identifiers: the name of the patient and at least the age. The two, because names, if you come to Kumasi here, names like Osei, if you mention Osei in the hospital, you can have 10 people showing up. But once you have Osei, it is very unlikely that two Osei people will have the same age. So at least once you have the name and the age, the two identifiers will likely be useful to identify the sample, all right, or the patient. So to identify, not just the name alone, age should also be included. So these two identifiers most appropriate. And then also the date and the time the sample has been collected should, as much as possible, also be written on the tube or the container. If the patient produces it right in the lab, then that case you can help the patient, because then the patient can give you the sample. You can help with the labeling. But if it's coming from far away, sometimes they even, in fact, from my practice, that was what I was. Sometimes they even, having produced a sample, they give to their wives to send it to a lab. Okay, because normally it's the women who rather put pressure on their men to produce a sample. It is the women who go to the hospital first. They bring the request. Sometimes they have to plead with the man. Once he decides to produce it, he produces and gives it to the woman. Okay, so how can you expect a woman to submit a sample without any information on it? So that is your responsibility to ensure that the sample is labeled right. So sample may be rejected if details on the specimen don't also match with information. This is fundamental rejection criteria in the lab. Any specimen, not just the semen. If the information on the sample don't match with the information on the request form, please reject. Outright rejection of the sample. And this is a standard practice. And applies same for the semen. Now, if sample is collected at home, as we've said, right, so this one that we've said, the labeling, whether it's producing from the home or in the lab, the labeling is a requirement, so essential. Well, what I'm saying here is that once it's in the lab, you can